As Ontario's Health Minister Sylvia Jones released a new plan to make healthcare fast and easy to access in the same province that saw more than 170,000 patients lose family doctors in the first 6 months of the pandemic. Looking now across the country, how many Canadians are still struggling to find designated health practitioners? Joining me now for more is Dr. Marla Shapiro, CTV medical contributor. Thank you, Dr. Marla, for joining us this morning.
Good morning.
So, Dr. Marla, how serious is this family doctor shortage in Canada?
So if we look at the numbers across the country, it is not just Ontario where we are seeing shortages. We are seeing shortages all the way across the country. Earlier this year, we reported on how serious it was in PEI. So we virtually have millions of Canadians who are unable to access care. And for those who do have family doctors, many of them cannot access care in a timely fashion. So definitely this is a countrywide problem that we're seeing.
And why? I think that's a question everyone has. Why is this happening?
I think it's happening for a number of reasons. Firstly, at the beginning of the pandemic, we saw an accelerated rate of retirement in terms of physicians. If we look at the year before, we've seen many more retire. And I think that the COVID pandemic did have a lot to do with really pushing a lot of physicians out the door. We also have the issue of how many physicians that are being trained are staying in family medicine are actually available to doctors. So there are a number of reasons: early retirement and just not enough numbers to meet the number one-to-one impact that you require when you need to see a physician. So there's a lot of reasons that we're seeing this shortage without any quick, easy answers.
And so then where does that leave patients? What does this mean for them?
It means that it's very difficult. I know within my own practice, every single day I have patients asking me if I can take on another family member. And typically that will happen a couple of times a month, or not all that often, because my own practice typically is closed. As physicians who've been practicing for a while, there's an upper limit of how many patients you can actually take care of effectively. So in my own practice, if it reflects what's happening in others, we're seeing these questions happen on a daily basis, and I'm hearing how difficult it is to find a doctor within their own community that they can see or they can access care. That leaves them going to walk-ins or taxing in an emergency room, which is the last place that we want primary care issues being seen.
So then what do you think needs to happen here? What are some of the strategies that need to be taken in order to solve this?
So we're seeing across the country the acceptance of the team approach. So more and more pharmacists are being given the ability to prescribe medications to a number of conditions that they can diagnose and they can treat. The concept of having team-based care, so that's not only a physician, but a nurse practitioner, a dietitian, a local pharmacist. These are wonderful options, but the reality is that you actually just need more feet on the ground. So that means retaining physicians, recruiting physicians, having more people in medical school that are being trained. We have to increase the number that we're trained, bringing in foreign medical grads, because when you look at these numbers and the doctor shortage, we do know that patients who have a primary care practitioner tend to do better in their health and in navigating the healthcare system. So this isn't a problem that's going to go away with easy short-term solutions, but we really need to have a long-term strategy in place to increase the number of practitioners and retain the number of practitioners and really focus on the best healthcare that we can give to Canadians.
All right, and a reminder, all of this information can be found on our website, ctvnews.ca. Dr. Marla Shapiro, CTV medical contributor, thank you as always for your time.